Hi, can two of you hear my voice? Can you hear me clearly? Okay.
Yes, I can hear.
Good morning, Professor Paul. Good morning, Xiao.
Can two of you hear my voice? Can you hear me clearly?
Now I'm hearing your echoes, but
Okay, let's start. Good morning, ladies and gentlemen, audience from YouTube and all over the world. This is Zhengxian Li from Tainan University, and I'm expert on electronic governance and public policy, including open data, data governance, and information literacy. I'm happy to be here to moderate this virtual conference on this morning. Actually, this is the second day of the conference. Yesterday, we have Audrey Tang, Maria, Scott, and many important speakers from all over the world. They are very devoting themselves into open government partnership. Taiwan also has our own OGP action plan in this year. Thanks for National Development Council and all the participants from both public and private sector, especially the Open Culture Foundation, aka OCF. Not only because they invited me here, but also thanks them to keep pushing this process to move forward. So if any of you are interested in OGP and its development in Taiwan, please visit their website or Facebook pages. Now, the topic of the conference is dialogue between the government and the civil society, public-private collaboration under the COVID-19. The first panel, Open Government Can Help Cases from COVID-19 Control and the Society Improvement. We are very grateful for the two panelists to join us. Please let me introduce them, and maybe two of you could say hi to today's online audience. The first one is Professor K.S. Paul from Korea University. He is also the co-founder and the director of OpenNet, and served as a commissioner at Korea Communication Standards Commission. The OpenNet Foundation and himself cares about freedom of speech, privacy, and digital innovation. Let's welcome Professor Paul.
Are you going to introduce the second speaker, or should I just say hi now? Okay. Well, thank you for the kind introduction. Okay, so I guess the second speaker is introduced later. Thank you for this great opportunity to share the success of open government movement. I call it a movement because it is a trend. It is a change that's made possible by collaboration between the government, civil society, academia, and technical sector. And that movement has caught on very rapidly around the world since we began 10 years ago. Now, I want to talk about how open government has improved our response to COVID-19 pandemic. Let me start with this. Let me share something first. I want to start with a good story. And then I don't want to end with a bad story, but I want to end with a story that makes us think. Okay, let's see. Okay, as you know, Korea is that is the map of South Korea in the middle. And sorry, it's all in Korean, but I just wanted to show wanted to give you a flavor of the variety and detailness of data disclosed by the government on the number of new cases, the number of patients being treated, the number of deaths. And that that level of disclosure was transferred not only to the extent of the pandemic, but the extent of, but also where we can get help. For instance, masks. Now the world has moved into vaccination stage, but if you remember last year, we were in the containment stage, and everywhere people were looking for masks. And this is a Korean news story showing describing how there are masks out there. In total, society-wide, there is no shortage, but there are shops that have surplus masks, and there are shops that ran out of masks, and there are people who cannot get the masks because there is no mask, but because they don't know where to get them. So a group of civic hackers asked, now this is again a Korean news story, a group of civic hackers asked the government to disclose, well, first collect information on where the surplus masks are, and then disclose the data in the form of API, open API, to the civic hackers. And they wrote these apps in different localities where people can check visually, as you can see in the middle. Neighborhood by neighborhood, where the surplus masks are, so they can get them quickly. So this is a good story. The whole process of opening up the data and making available the mask apps, that took only about 3 weeks. So this is a good story of open government that I want to share with you. Now, there are other apps as well where the government disclosed the itinerary of COVID patients. And those apps also visualized for people to know which places to avoid. That is another, I mean, that was something that was done by voluntarily by the government. Now, I want to move on to another story that we should think about, not celebrate, but think about. As you know, last year, Korea was one of the very few countries, probably among the developed countries, probably the only country that maintained open border and open business policy throughout the year, while the rest of the world was shutting down their business. The reason we could do that was, I mean, last year we were so successful in containment. We are so successful in containment that we, in some parts of the year, we kept the number of new cases down to 100. How was this possible? Well, this is a kind of, these are the countries that did contact tracing. Now, on the top, Korea and Israel were the only two countries that used cell tower ID-based location tracking. All other countries that engaged in digital contact tracing used GPS-based apps. which will not be effective unless people actually download them and use them. So these other countries' contact tracing relied on the voluntarism of the people, but Israel and Korea, but by the way, Israel's system was, I'll talk about Israel a little bit later. Korea was the only country that used cell tower ID based, which did not require app to be downloaded. And also, we have this Article 76-2 of Infectious Disease Prevention Act, which allowed mandatory location tracking, which means people were tracked against their will. And it was, so legally, it was made possible. And technically, it was possible because we used the cell tower ID based, which means even people without smartphones, the people with the feature phones could be tracked against their will. Now, you can imagine the privacy problem with this, that the government could track your movement once you are identified as a COVID patient. Now, I'm gonna broaden. I'm gonna tell you that there is even more extra surveillance there on not just patients, but people suspected, not just of people suspected of being patients, but also people being suspected of being in contact with the patients. All these people could be tracked on their location by the government. Now, because of this privacy risk, the Israeli system was struck down as unconstitutional by the Israeli Supreme Court. OpenNet Korea, which is I'm a director of, has filed a constitutional challenge against Korea's law, but it has not, the Constitutional Court has not reached a decision on it. Now, I just don't want to, we didn't file a constitutional challenge because we are convinced that it should be, it is unconstitutional or it is human rights infringing. Information is vital for saving people's lives. One of the important human rights is right to public health, a right to livelihood. If information on where COVID patients are is important for preventing other people from contracting COVID-19, there may be public interest in sharing that information even against the will of COVID patients. We don't know yet. We filed the constitutional challenge because we thought that we need to have a discussion instead of jumping right in. We jumped right in back in 2015 when Korea was hit by MERS outbreak. If you look at the graph on the right side, you see this, you can see like month by month change of number of new cases of Middle East respiratory syndrome. You can see most of them is blue or light blue. These are all from Middle East countries. The huge peak in 2014, that's Saudi Arabia. Now, you see the red peak on the right. That is Korea. So by middle of 2015, that Korea was world's capital. Korea was world's capital of MERS. That people were jokingly saying that we should rename the disease to CORS, Korea respiratory syndrome. Now, but we did successfully contain it after some crises. Korean Societies of Infectious Diseases which was a group of doctors and public health experts, wrote this demand, which was not published, wrote this demand to the government, listing the lessons that they learned from their responses to MERS outbreak. There were three things: full disclosure of all contactees, the people who came into contact with patients. They emphasized that they emphasized that they need this information despite side effects, and tracking all the patients and contacts, and put the leadership of pandemic response or the infectious disease response with the experts on epidemiology. They said if these three conditions are met, then they'll promise to contain MERS or any other similar outbreak. Now, after these demands were made to the government, the law was changed, and there we saw the birth of the world's only law, probably only law, that authorizes mandatory location tracking of patients. Now, the reason the epidemiologist made this demand was that the traditional contact tracing during MERS outbreak just did not work because the problem of dishonest patients. Now, out of a total of 153 patients, MERS patients, 90% of them were infected by 4 super spreaders: number 1, number 14, number 16, and number 1, number 14, 15, and 16. And all of them gave inaccurate stories. A lot of times intentionally, to avoid the stigma of patients, and that have misled the response efforts and caused this effect of spreading to many people. And that's why the epidemiologist demanded this more effective contact tracing, even if it means getting the information about the patients against their will. So this is a very serious issue to think about, because yes, information is vital, but how do you weigh the privacy harm to the patients and the contacts versus the importance, the value of public interest that the authorities can obtain from that information in saving further lives? A lot of people's response, a lot of countries' response to the Korea example have been ignoring it, meaning that, oh, okay, maybe Korea can do that because the Korean people don't care about privacy. A lot of them fall into cultural relativism. They could cultural relativism, where they'll say, oh, Korea can do that because Koreans have different privacy culture, but we cannot do that because our people respect privacy. But that is not true. Korea has one of the strongest data protection law around the world. The reason that people have worked with, cooperated with this legislation is not because they don't care about privacy, but because they had a greater sense of participating in this public effort for COVID prevention. I'll stop here for now, and I'll talk more about the problems of this problems and challenges of COVID-19 prevention in Korea.
Thank you, Professor Polk. Very, very great speeches. Share Korea's active during the COVID-19 for us. And then now I have to introduce our second speakers, Xiaoxin Chen. He is a civil member of Taiwan MSF. He launched the National Treasure Civic Tech Project, and he really cares about the social issues and our state. Before Xiao starts, I want to mention that you have 15 minutes to share your speech, and we have Slidos for everyone to raise your questions. And after 15 minutes, we'll have a Q&A section with Professor Polk and Xiao. So the stage is yours.
Hello, everyone. Hello, friends in the audience. My name is Xinchen Xiao. I'm the civil society member of Taiwan's Open Government, as well as Open Parliament Multi-Stake Foreign Committee. I'm extremely honored to be invited to give a talk in today's panel, and also extremely honored to be talking alongside Director Kyung-Sin Park, because my talk is very similar in content. That's in part because Taiwan's COVID response is very similar to Korea's. Let me just share my screen. Okay. So yeah, today I would like to talk about how Taiwan's open government practices affects Taiwan's COVID pandemic response. My slides projected, right? Okay. So yeah, so my talk would be in three parts. So number one, I'll talk about Taiwan's strong COVID responses. Taiwan has been known around the world to have one of the fewest cases per capita, and in part that's because Taiwan, number one, has suffered greatly in 2004's SARS pandemic, and since then we created a set of measures and agencies to help combat future pandemics. And number two, we'll talk about challenges in open government principles in the COVID era. So because open government is effective in some ways in creating some transparent and policies, but in a rapid response to a pandemic, open government's principles may face some challenges. And number three, we'll talk about post-COVID practices in open governments. Although it's probably too soon to talk about the phrase post-COVID, but in some way we have to think about the practices in a COVID response times cannot be indefinitely extended, right? For example, emergency powers. So in some way we have to think about what a post-COVID practices will look like in a democratic society. So yeah, number one, Taiwan has been suffering with COVID along the rest of the world. Although we have some experiences, because in 2004 we suffered the SARS outbreak coming from China as well. And during that time, the government established a National Health Command Center. So the NCCC is part of the disease management center that focuses on large outbreak responses and acts as the operational command point for direct communications among central, regional, and local authorities. So during this COVID response, the command center quickly enacts border control and case identification for or so-called contact tracing and containment efforts. So we are very similar to Korea's efforts. We have contact tracing as well using the cell towers. So every foreign travelers entering Taiwan has to, number one, enter into a 14-day quarantine, and they will be traced by their cell phone data. So if they leave their quarantine, the local authorities will be immediately notified, and they will see police show up at their doors. So we have very, very strong COVID response. And the second component to that is we have a strong civic society. For one of the, for example, would be the face mask map that Audrey Tang, Minister Audrey Tang talked about yet in yesterday's panel. And the story of this map is just like many stories of Taiwan civic tech successes, is that it began with just local engineers' effort to try to come up with something for the use of his friends and families. So he used his expertise to create a map that that showcases the storage of masks in nearby medical facilities, and he uses his Google account, and then very quickly he see that the bills keep racking up, and to a point that he cannot afford it. But once the news exposed his efforts, Google, take away his liabilities, and then the whole community came in and help out this project. And the second component is that, however, useful this map is, a civic engineer does not have the access to enough data, right? So although Taiwan has a very robust open data program, the data available is still quite limited as pertaining to medical face masks. So that's where the Minister Audrey Tang came in, and then he shepherded the government's effort to make sure that enough of the local clinics data, the face mask storage data, and the geographic data are all being open, and then to make sure that when the civic society came in, they have enough data to work with to have a much robust face mask map. And this is what the story that's known around the world, that Taiwan civic society came up with such a tool that even spread around the world, even to Korea. So yeah, so as Taiwan's civic COVID responses is consists with three secret sources. So number one is a strong civic tech community, and number two is that open data tradition, right? Because the government has been used to over the years to open its data, and so once the COVID came in, they can ramp up the effort and then open enough data for the community's consumption. And number three, of course, that's unique to Taiwan, is that we have such a digital minister that can act as a bridge between the civic tech community and the government agencies to make sure that whenever there's a roadblock, it can be resolved quickly. But number two, I mean, it's not without concerns, right? So whenever there's a COVID response, there's a privacy concern, just like Director Park mentions in Korea, and in Taiwan, it's the same. So what are the privacy concerns in a strong COVID response in Taiwan? It evolves around three parts. Number one is the boundary in emergency powers. So in Taiwan's COVID response, the government used the so-called emergency power declaration to make sure that they can, for example, bypass personal data protection laws, and then to act unilaterally in a way to make sure that they can enact border control, contact tracing, and disease containment. But the blanket emergency power authorization sets no clear boundary on how personal data protection laws is loosened. So that is one of the privacy concerns. Number two is the disclosure of data collection policy. So even though this concern has been lessened in the past few months, still, if you ask a random Taiwanese walking on the street, do you know how your data is being collected and processed in a COVID response? by the government? I don't think many people will be able to answer the questions. We can very conveniently scan the QR code and go into stores, but does anyone know how this data is being used, collected, being monitored, and audited? I mean, that's in that effort is still leaves a lot to be desired. And number three is the most important, is that we still lack an independent data protection authority. So right now, we have a data protection agency, but there's no independent data protection agency that can monitor and that can audit the government's use or emergency use of personal data in order to fight the COVID pandemic. So a lack of such agency creates a concern that although the government is acting in goodwill to protect people's health, but in the end, we don't know how to guard against any misuses. So in summary, open government and pandemic control, the truth is open governance is not the best tool to use in a containment scenarios, right? Because if you see in China, they quickly contain the disease by enacting strong quarantine laws. They removed patients, they even jam them out of their homes, and they can do so because the government has absolute power in these scenarios. So I mean, in that respect, democracy may not be the best tools in the rapid containment scenarios. However, that being said, it is clear to see that Taiwan's population has generally accepted the government's use of its emergency power and the technologies. It's not only because government's transparent communication of disease control measures on a daily basis, but also the citizens' trust in their democratically elected and appointed bureaucrats. So this quote underlines the most important issue, is that is trust. So if the population does not trust the government, the population may abide by the government's disease containment efforts, but to some extent, that effort is going to wane and wane, and then the disease is going to break out of control again. So trust is very crucial in a sustained disease control and recovery efforts in the population. And how does the government create trust? I mean, it can be said that the government creates trust only by open government practices. So that's where the government's, Taiwan's open government commitments come in. In the past months, the Taiwan's Open Government Committee has been crafting commitments in the area such as open data, so to push for more effective and accessible open data frameworks across government agencies, and also participation. We encourage more participation in the decision-making process, making via the e-joint platform that is spearheaded by Minister Audrey Tang. And also inclusion, right? So the decision-making process needs to be diversified. We have the gender, we enact the gender across the gender, youth, Aboriginal, and immigrant policies to make sure we help diversify the civic engagement. And lastly, the last point, but it's not the last commitment, is data protection. One of the most important, in my opinion, commitments will be the commitment to strengthen the personal data protection laws in Taiwan in digital era. So because now the pandemic control tools are mostly digital, how we guard against misuse of such data is very important. So in making such commitments, I think Taiwan's open government practices will help generate more trust in governance, and that in turn will help Taiwan's COVID response or sustain COVID response and recovery. Because the recovery is very important, right? It's not only just the response, because in the next year or two, when the vaccine coverage is getting higher and higher, then it looks like would be we are faced with a phase of COVID recovery, and in that I mean the trust in government of how all those data that's being collected and used, how they are gonna end up is very important. So that would conclude today's talk, and hopefully I put enough questions in your minds that the Director Pao and I will be able to answer in the next Q&A sessions.
Thank you, Xiaoxing Shen. Thank you for your speech, and let's welcome Professor Pork on the stage again. We have 15 minutes for the Q&A section. Before that, I want to apologize to Professor Pork because glitch problem, your slides didn't show correctly on the screen. So please show your figures. Yes, thank you in here. And for the audience, that you may clearly see the countries and their location tracking technologies on the slides.
Sorry, we didn't have time to add Taiwan in there. So this is the slide showing different countries, and wanted to show Korea and Israel were at least at the time of research we thought was which was last year. We thought were the only countries that were doing mandatory contact tracing, meaning contact tracing against will of patients, or regardless of will of the patients. And second thing, the second slide I showed you was the graph on the right showing the number of MERS cases. You can see the red peak, high red peak, which really gives us a flavor of the level of a crisis, or the level of crisis-based thinking that went into this law, this new law that authorized mandatory contact tracing. And also this graph shows how the problem of I mean, I'm really sorry to say this about people who are already suffering from disease, but the problem of dishonest patients who have pointed the country to the need for mandatory contact tracing. Having said that, I wanted to ask the Mr. Xiao whether Taiwan has a law in place that also allows mandatory contact tracing. Is that what I heard from your presentation?
I don't think we have such laws, but the contact tracing should be within the emergency declaration. So the government declare emergency, then that's part of one of the measures they enact would be contact tracing. Yes.
Oh, I see.
Okay. Thank you for two of you. I think I have to interrupt Professor Pork's sharing because we have some Q&A questions from Slido. From my point of view, thank you for two of you mentioned about social trust and also the personal data protection issues. So on Slido also have some questions about that. There are 5 questions. I think we have enough time to answer all the questions, but I think maybe we only have 30 seconds for each question. I apologize for that. So the first question is, especially since the pandemic, well, like at least a long time, do you worry about the emergency powers used during the pandemic will become a new normal? Any one of you want to answer this question?
I can answer that. For Korea, actually, I told you about Israel, and I think it is similar to Taiwan. It is under emergency powers that authorities could do mandatory contact tracing. So in Israel, I mean, because of the geopolitical situation, Israel has been under ongoing emergency. So the security agencies have very strong surveillance powers, and they just used the surveillance. They just adapted the surveillance powers for disease prevention purposes. Now, for that, the Constitutional Court, the highest court of Israel struck it down, saying that the emergency powers were not contained, were not restricted with a concern for privacy, and that it has to go through a proper legislative process. I think Israel passed. So Israel try to cover that statutory gap, but during the time the world moved on to the vaccination stage, so I didn't follow up after that. Now for Korea, it has been part of the ordinary statute. So even without exercise of emergency power, Korean authorities can do mandatory contact tracing for any infectious disease. So, I mean, not any, but there is a list of selected diseases that they can do a mandatory contact tracing for. So, will it become the new normal? Well, I think that possibly, but thankfully, the vaccination, the world has moved on to vaccination stage, so that the need for mandatory contact tracing has lessened, has become less. So hopefully we'll find a happy middle ground between privacy and public health.
Thank you.
And I'll take the third question. Do Korea need an independent agency, ICO, like UK? Yes. Actually, Korea created just last year an independent agency. When I say independent, we are not talking about an agency we're not talking about, just a standalone agency under a certain ministry. When we say independent agency for GDPR compliance purposes, we are talking about agency at ministerial level that is independent from other ministerial goals and influences. And we have that now. That was one of the reasons that Korea could not pass the adequacy could not obtain adequacy finding under GDPR purposes. You know that the Korean data controllers need the adequacy. The European data controllers and also Korean data controllers need adequacy finding for Korea to transfer Europeans' personal data into Korea. And European Union is, I think, is close, like 90% close to making a final finding of adequacy on Korea, thanks to that structure change.
Okay, thank you. I think this question is for Xiao. It seems that there is a balance between safety during the pandemic and the human rights. So, how to find a balance with civil society, from your point of view?
Yeah, this question is somehow related to last question about the new normal of emergency powers, right? So I'll probably answer them together. Is that if the pandemic were to last much longer, of course we need to find a balance, between safety, between health and human rights and civil society, with coexisting with the pandemic and the emergency powers. So number one, we have to find a way, preferably through open governing practices, that to rein in the emergency power to enact appropriate laws and regulations for the government to follow. So they cannot use blanket emergency powers authorization to do everything indefinitely, right? Because if the disease were to transform into like a seasonal flu, and then that's something we need to deal with every year, then that is a point where we need to think about how the emergency powers are terminated, and then make sure that there's a proper set of rules, for example, regarding the contact tracing, how the data is to be collected and used, and how to be audited. So that is something that definitely for the civil society to think about, for the ordinary citizens to think about, and also especially for our parliaments and the member of parliament to think about. Because right now, I mean, even the member of parliament, they don't have any say about the governmental emergency practices, right? They don't have any overseeing power on that. So, and that would be a deviation from a democratic institution, democratic processes, right? So that is something we need to think about seriously here.
Thank you. Thank you.
I can say, I think that these two remaining questions are related to each other. So I'll answer that. Now, this is my personal opinion. This is not an opinion of my organization, OpenNet Korea. But this is what I learned. Civil society response and people's response and human rights organizations' response to mandatory contact tracing were a little bit unexpected in the following sense. The Human Rights Commission of Korea commented on the contact tracing law, not on the fact that it was being done against the will of patients, but the fact that the itineraries of patients were made public to the people. It was the disclosure of the information, not the collection of the information, that the Human Rights Commission criticized. And that problem was adequately addressed by anonymizing the itineraries. For instance, of course, taking out the name, taking out the age, taking out the address of the patients, so the information granular enough, just granular enough for people to take precaution, but not granular enough to pinpoint who the patients are. So that was properly addressed. Now, the civil society responded to the contact tracing not when patients were traced, but people who were in the same area were location tracked. What do I mean by this? I mean, the law says patients could be contact traced, and says the law also says people who are suspected to be in contact with patients can be traced. But there was a moment, there was an episode where about like 10,000 people in one, like 5 city blocks were contact traced all at the same time because of one case found in that area. The idea was that they could. I mean, the idea is that physically they could be in. They could have been in contact with the patient, but physically I mean, scientifically, it was impossible for one person to be in contact with so many people in that short time period. So I think what people were worried about is not the fact that patients are being traced against their will, but even people who are only remotely possible to be in contact, remotely suspected to be in contact with the patients were being traced. So this type of mass surveillance, I mean, once you say that people who are remotely suspected could be traced, we are opening up a possibility of a mass surveillance. A lot of people who just have no chance of having contracted COVID or having contacted a COVID patient will be location tracked. So if we take out those, if we take out the disclosure problem, and if we take out the mass surveillance problem, maybe at least Korean people have shown that we can set up an effective mandatory contact tracing. And I'm hoping that this lesson is at least tested in other countries as well. Especially countries like the US have just given up on contact tracing, because if they do it through voluntary method, it just becomes, it just takes a lot of time to interview each of the patients. And later you just give up after you fail to contain the initial outbreak, because after the number grows out of scale, contact tracing becomes meaningless. So hoping that before the next pandemic hits, other countries take a look at the Korean system to buy enough time for to move into the vaccination stage. And our constitutional challenge was kind of an attempt to have that serious discussion, not really, take down the law, but to have discussion on it. And for that reason, we have involved experts from overseas to intervene in our lawsuit as experts as well.
Thank you, Professor Paul. I hate to do that, but we are run out of time, and we have a tight schedule this morning. So I want to thank you, both of you, to come to the virtual conference, and maybe we have more discussions somewhere else. Thank you. For the audience, we have 5 minutes break, and after that, we have Professor Rosie and want to share her speech with us. So stay tuned. We'll come back in 5.